Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
It kind of feels like we are moving on. Mask orders are gone. Also, proof of vaccination has completely disappeared. It's hard to hear that all of these things are ending, and I still feel like we're hearing about new infections. We're entering the fall, and we should expect a surge.
You're listening to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. I'm Stephen Newmark, Director of Policy at the Global Healthy Living Foundation.
And I'm Zoe Rothblatt, Associate Director of Community Outreach at GHLF.
Our goal is to help you understand what's happening in the healthcare world to help you make informed decisions to live your best life. But before we get started, we want to be sure that everyone takes a listen to all of GHLF's great podcasts. We have so many to choose from.
We sure do, and as a reminder, you can check them all out at ghlf.org/listen. This week, we'll give a shout out to Wellness Evolution. We know it's a really stressful time with, the end of summer, lots of changing guidelines, so definitely take a break and listen to how the hosts are practicing wellness.
Excellent.
So let's start with a listener comment. Ready, Stephen?
I am ready.
This one is from Claude P., who wrote, "Engaging hosts really enjoy this podcast."
Well, thanks, Claude. We really enjoy putting on this podcast, and we really appreciate your listening.
We sure do enjoy it so much that we are back for season 5. We're so excited to keep this show going and talking to you all.
Yes, season 5, and there is already a lot to talk about.
That's right, Stephen. As the COVID-19 pandemic lingers, many restrictions and protective measures have been relaxed quite a bit, but we know that healthcare professionals are still at the front line of this, and immunocompromised patients in our community are still at risk. So is it really behind us? What's going on with the pandemic?
Well, we'll talk about that in a few minutes, but first let's start with some news from the week. First up is the new boosters. The new boosters are here. The FDA has authorized 2 updated boosters, the bivalent COVID vaccine of Moderna and Pfizer. If you're at least 12 years old, don't have an active COVID infection, and it's been at least 2 months since you've had a booster, you're eligible for the new booster.
Okay, big round of applause. This is exciting. I know many in our community are excited about it because, there's been sort of a drag with getting vaccines, and people may not have mounted a full response to the first vaccine, and then to have new variants, which that vaccine didn't necessarily cover. This is really exciting because it covers that dominant strain of Omicron.
Yeah, first of all, not only will a booster with the new vaccines decrease the likelihood of infection and severe illness, but it could also decrease the likelihood of developing long COVID.
Yeah, which we know is a concern for our community who already lives with chronic illness. You don't want to add another chronic condition on top of that. It is a lot to manage.
Right. Many folks in our community have already gotten their boosters, and some have reported getting that and the flu shot at the same time.
Which is awesome. It's always good to hear from people about their experiences. But as a reminder, always talk to your doctor about getting this shot, and if you need to pause any regular medications, to do so.
Now, obviously, having just listened to this, our listeners know all about the new vaccines, but there is some bad news. The boosters are getting very little fanfare. And, there's a fear that too few people might get them. The CDC has said that a national survey found that 72% of respondents said they were likely to receive an updated booster. But to actually get them vaccinated requires making the boosters easily accessible and making sure folks know about their benefits. So hopefully we're continuing to get the word out. And I would put forth onto our listeners, don't just get a vaccine yourself, but make sure to spread the word about the new boosters.
That's a really good point. And you could also point people to this tool on the CDC website that calculates if you need a booster. You put in your age, if you're immunocompromised, what vaccines you got in the primary series, if you've got a booster, and it lets you know if you are eligible for this vaccine. So that's a really great tool for people who just simply don't know the answer.
So more good news, the uninsured rate has approached a record low. The census numbers that were just released show that 8.3% of Americans, or roughly 27 million people, did not have any health insurance in 2021. While that's still, I would say, unacceptable, it is an improvement from 2020, when 8.6% of Americans were uninsured.
And this is a result of Medicaid, which is the public health insurance option for people with low incomes. And what's really interesting is that Medicaid rates have increased because of the COVID relief bill that Congress passed in March of 2020. So I guess you could say, there's some good that's come out of the pandemic because the Family First Coronavirus Response Act basically mandated that Medicaid programs not not force enrollees to re-qualify for the program. So it just eliminated a lot of those extra steps, like, having to fill out more forms, realizing the plan year is ending and you have to, get together all your stuff and re-qualify. You just sort of rolled into the next year. So Medicaid enrollment has grown.
Yeah, it's important to advocate, talk to your elected officials about the importance of health insurance and how it helps you to stay healthy.
Totally. And if you want to do so, you could always join our 50 state network. We're a group of advocates, and we will help raise your voice to legislators and talk about issues that you care about. Okay, Stephen, I want to give a quick update on the methotrexate access issue. We haven't talked about it in a bit, and it feels like it's maybe died down a bit. I'm hearing less from our community about the issue, and I guess less from the media too.
Well, let's remind our listeners what the methotrexate issue exactly is.
Yeah, good call. So, after the overturn of Roe v. Wade in some states with trigger laws, they called out methotrexate as a restricted drug because it has this other use that it can be used for an abortion. But we know that many in our community take methotrexate for things like rheumatoid arthritis to help, control their arthritis and avoid irreversible joint damage. Actually, methotrexate's been around for decades. It's like one of the oldest drugs used. So, obviously when they called this as a restricted drug, people started having access issues. And I wanted to share that I actually take methotrexate, and I moved to Tennessee. I was a little bit worried based on the laws here, and I was able to successfully order it. So I wanted to tell our listeners, my specialty pharmacy worked for me. And when I talked to others in our community about this, I learned that, it might be a problem at the local pharmacy, but the specialty pharmacy is a really good resource. So definitely, talk to your doctor about what the best pharmacy is to work with when you're ordering your medications.
Well, that's great news. I'm glad to hear that the stories from our community seem to be dwindling in regards to this topic. That's a good thing.
Yeah, me too, because no one should ever have to take extra steps to get their medication. Like, even if they are able to get it, if it takes, more prior authorizations and verifications, it's still delaying people, which just isn't fair and leaves people in pain.
Absolutely.
Okay, let's go back to my original question. Are we still in a pandemic?
That's a long-winded way of saying I'm not sure. I will say that precautions like masking and distancing are clearly not being enforced. But that said, healthcare professionals are still on the front lines of the pandemic, and high-risk patients are as well. And folks are wondering if the country as a whole, the world as a whole, is moving on too quickly.
It kind of feels like we are moving on. Capacity limits are gone. When you go into places, I'm seeing that restaurants, like sporting events, everything's at full capacity. It's
Yeah.
mask orders are gone. I just took a flight. I was one of 2 people in a mask, and also proof of vaccination has completely disappeared. There was a while where we had to show our vaccine card to get in restaurants, and that's gone too.
Yeah, it's true. We never have to show vaccinations anymore.
And on top of that, the CDC recently loosened the guidance on social distancing and quarantine. And, the free government at-home COVID-19 rapid test program ended earlier this month, which, it's hard to hear that all of these things are ending. And I still feel like we're hearing about new infections. BA4 and 5 are swarming. We're entering the fall here. And based on previous years, it feels like we should expect a surge.
Yeah, so let me ask you a question. What would be one positive that you would take from the last 2.5 years? And also, I'll ask a second follow-up question on top of it. What is one thing you're currently, September of 2022, that you're dispirited about at this phase of the pandemic?
One positive, I think people are more aware of, staying home when you're sick. I think before, like a lot of people I remember used to show up to class with a runny nose, and I would feel so upset because I'm like, what are you doing here? You're going to get others sick. And now I think people know, if you don't feel well, take a step back and stay home. It doesn't have to be COVID, like any illness, like really you shouldn't be spreading it because you don't know who around you is high risk.
That's a good one.
And to answer your other question, what am I sort of feeling like dragged and upset about? I'm feeling upset that it feels like most people around me are talking about COVID as if it's completely in the past. And I don't know how you get people to realize it's still going on. And I'm fatigued too. I'll admit I've become more relaxed with the mask, especially when no one around me is wearing one. It's hard to keep it up. It's exhausting, and you want to be social and protect your mental health. But at the same time, it's really hard to balance all that. And Stephen, I'll throw the question back to you. I'm curious to hear where you stand with all this.
I like what you said about being sick. Just a quick anecdotal story. I was talking to a friend who works at a big Fortune 500 company. And, the joke there about the sick policy was there is no sick policy. There's no such thing as calling in sick. But that has completely changed. So that goes to your point. But just so I don't take the same answer as you, I think one of the things I do like is that it's become somewhat acceptable to wear a mask in public. And I like that, COVID aside, I like that for the flu season. On the flip side, where I am today, I think what I'm most frustrated is I hear some variation on the phrase of, oh, it's like the flu. It's like a cold. It's like the flu now. COVID is just like the flu. And it's not, because the flu infects and kills a certain amount of people each year, but the amount of people that have died as a result of COVID just dwarfs anything that comes near the flu. It's not the flu. I think conflating the two is problematic.
And, the flu is still very serious. We get our flu shots every year for a reason. We can't just say, oh, it's just the flu.
Right? Who wants a second flu out there?
Yeah. And, with the flu, we know that it's seasonal. There's, I guess, a time of year where we could sort of take a break from it. With COVID, we haven't had that luxury. It's been nonstop.
Right.
So, where do we stand with vaccines? One of our best tools when it comes to COVID. I was looking at some numbers. Only 67% of the US population are considered fully vaccinated, and only 32% have received a booster. So when you think about that, what even is fully vaccinated anymore? If you got your first series in 2021, we're nearing 2023. Is that still protective? Is the number of people protected really at 32%? So we'll see what happens with this new booster, but there's still a lot of misinformation out there, and I guess vaccine fatigue is something I've been thinking about recently. Experts are saying we're going to need a flu shot and a COVID shot every year, and it's a lot.
Right.
So I think it will be easier as time goes on and we get more defined time periods to get the vaccine. We know annually get your flu shot. With COVID, it's been sort of a peek into the news and figure out when you need it. And that's a little fatiguing. But once we get on a rhythm with it, I think it'll be, helpful and more understandable.
Yeah, that's a good point. There's a timing element. You discussed the tool on the CDC's website. If you contracted COVID, how long has it been? You have to plug in different permutations to figure it out. It's early September. I have an appointment to get my vaccine. I haven't gotten it yet. And part of what I'm waiting for, my appointment is in early October. I kind of want to, I want to get a little bit more separation since I contracted the illness. I'm also of the mindset, should I wait until there's a particular moment, a particular event that I'm going to be at, Thanksgiving perhaps?
Right, with the holidays, what will those look like this year?
Right, so do I want to wait to get the vaccine, let's say 2 weeks before then, so I have peak immunity for something like that? It's such a tricky thing.
It's so tricky, and something else I want to mention here that I was reading comments from people in our community is that many feel unsafe to even go get the booster because in some pharmacies people aren't wearing a mask, so it feels risky, to go in and the person administering the vaccine may not be in a mask, and you're trying to get this protection, but you also could be putting yourself at risk at the same time. And I think these little nuances that feel so obvious to our community aren't coming through in the general public, and that's where we feel left behind.
Absolutely. So given all this, I guess it feels like the pandemic is still ongoing in some twisted way, and we'll keep at it here, of course, on the Healthcare Advocates.
Yeah, I would say it's still ongoing. We pointed to a lot of things. We pointed to the impact on healthcare, immunocompromise, long COVID, the vaccine conversation, different restrictions are still being talked about, whether they're removed or here, they're being talked about. Given all that, to me, it feels like the pandemic's going on. And then, I'm like, am I in a different world than everyone else? But you add up all these points and yeah, it's still going on.
Said this really well, the executive director of the World Health Organization.
We have never been in a better position to end the pandemic. We're not there yet, but the end is in sight. A marathon runner does not stop when the finish line comes into view. She runs harder with all the energy she has left. So must we. We can see the finish line. We are in a winning position. But now is the worst time to stop running. Now is the time to run harder and make sure we cross the line and reap the rewards of all our hard work.
Okay, Stephen, that brings us to the close of our show. What did you learn today?
Well, I learned from you about the CDC's tool. I actually was not familiar with that, but I'm excited to start plugging it in, and maybe then I will actually figure out when to get my booster.
And I learned from you about how the uninsured rates decreased as a result of Medicaid expansion during COVID.
Well, we hope that you learned something too. We'd love to hear from you. Email thehealthadvocates@ghlf.org, or better yet, include a short video or audio clip.
And who knows, whatever you share may be included in our listener feedback portion of future episodes.
Also email us if you want to subscribe to our weekly newsletter where we share the top health news of the week.
Well, everyone, thanks for listening to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. If you like this episode, give us a rating and write a review on Apple Podcasts, and definitely hit that subscribe button wherever you listen, and share this podcast with your family and friends. It'll help more people like you find us. I'm Zoe Rothblatt.
I'm Stephen Newmark. We'll see you next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.